Alrighty, I'm just making sure we are live here before we start chatting, and I think we are good. So, hello everyone, and welcome to day one of the Boys Town Pediatrics Spring Newborn Expo. My name is Gabby. I am your host for the week. We are going live every single day with a Boys Town pediatrician on a different topic as it pertains to you and your newborn. Today we are live with Dr. Danielle Empson on the topic of feeding. So we're going to be discussing both breastfeeding and formula feeding, as well as troubleshooting and tips with those. So if you're watching live, we are doing a live giveaway. So if you are interested in winning a stuffed bear with a detachable blanket from Boys Town Pediatrics, make sure you like this video and leave a comment to be entered. You can comment anything, say hello, comment throughout the live with a question that you may have on anything we're discussing, and you will be entered. And if you haven't disclosed your pregnancy to friends or family yet, and you don't want to leave a public comment, you can always message our inbox directly, and that will be private, and we will take all entries and questions that way as well. So, Dr. Empson, how are you doing today?
I'm doing great. How are you, Gabby?
Good. It's great to have you on. For those of you who might not know Dr. Empson, tell us a little bit more about yourself and your role at Boys Town Pediatrics.
Yes, thank you so much. So glad that you all are here to join us today. I'm Danielle Empson. I'm one of the pediatricians here at the Maple Street Clinic here at Boys Town. This clinic is our newest clinic. It's been open since April 2022, so almost 2 years. But I've been at Boys Town since 2016. I am a mom. I have 2 kids of my own, and this topic is near and dear to my heart. I have breastfed both of my kids into the toddler age period, so I feel like I have a little bit of experience here, and infant feeding as well. And then I just hope to share a lot of information with you guys today.
Wonderful. All right. Well, we are going to hop right into our discussion questions. Here we go. So the first one says, if I am pregnant and hoping to breastfeed, what should I be doing to prepare?
One of the first things that I tell all expecting parents is if you want to breastfeed, it is really helpful to do like an online course or an in-person course to learn about lactation. Everybody kind of talks about, oh, it's this natural thing, but there's definitely a learning curve. I myself took an online course. My first pregnancy was right in the thick of COVID. So I couldn't do a in-person course, but I did some online courses. I knew some information about breastfeeding, but I learned a lot. Even just watching videos on the internet can be super helpful. And then I always tell families too, once you're in the hospital with your baby, utilizing lactation consultants as much as you can. I am not a lactation consultant, but pediatricians have a lot of resources to help you out with feeding too. So I think those are always good options.
Definitely. What is the time commitment for breastfeeding in the early weeks and then as baby ages?
Not to scare anybody, but I feel like in the early weeks, right when you have a newborn, it's almost a 24/7 job. I mean, being a parent is a 24/7 job, of course, but breastfeeding in those early stages, you almost feel like you're doing it nonstop. So babies in the first few weeks of life should be feeding like 10 to 12 times a day, especially if they're nursing or breastfeeding. So that is every couple hours or so. And then if the feeding is lasting 20 to 30 minutes, then you might feel like you're really feeding all of the time. So it is a big time commitment, but I think if your goal is to breastfeed, it's definitely an important one and one that's worth it. So having a good recliner, I think, can be really helpful because you'll be spending a lot of time in that chair. Was that okay? I know that was the first part of the question. What was the second part?
So that was, you talked about when they were newborns,
yes,
the time commitment. What about when they're older?
Yes. So once breastfeeding is established, it can go much more quickly, much more smoothly, and be an easy process. As babies get older and they're eating other types of foods, they may nurse a handful of times a day, and the session may be less than 5 minutes. So quick and easy, portable. That's the nice thing I like about it. You don't have to bring stuff with you.
Yeah. Well, if you're watching and you're trying to find something for your partner to do while you're preparing for breastfeeding, you can have them shop for a nice recliner.
There you go.
Heard it from Dr. Empson. Yeah, that's great. The next question is, what does cluster feeding look like? What is it for maybe
Yes.
breastfeeding?
So, breastfeeding is all about supply and demand. The more that a baby latches on and nurses, the more that that breast milk will be made and help come in. So those early days, babies are only getting colostrum, which is that really thick, nutritious breast milk, but only small amounts come out at a time. As babies feed, the breast milk comes in between days 2 and 6 of the baby's life, and then they may cluster feed to try to get that milk to come in even more. So again, the more that baby latches, the more that they feed, the more that milk will be produced. And then again, it's supply and demand. If the baby's feeding, they'll make more milk and meet their demands. But cluster feeding is really when those babies are wanting to feed every hour or so. And the way to get through it is kind of power through, and again, make sure you have a comfy, cozy chair. And sometimes babies will use breastfeeding to kind of pacify themselves. Are they really hungry, or again, are they trying to establish that milk supply, or are they just trying to use it as a comfort mechanism, which is totally normal and totally fine too.
Mm-hmm. What do we need to know about pumping?
So yes, if you plan to breastfeed and are going to be away from your baby for any period of time, whether it's going to have a girls' night out or a date night or go back to work, then you may need to pump to remove that milk. If you're not removing the milk when the baby would normally feed, then again, that supply can go down and dip. So that's why we use breast pumps when we're away from our babies. Super helpful as a supplement to help us continue to breastfeed. There's lots of different pumps out there, lots of ways to get resources on that. So again, using lactation consultants can be super helpful to find out which pump is right for you. There's different sizes of the parts that you use for pumping. Trying to think what else I can say about pumping. So your obstetrician gynecologist can get you a prescription for a pump, and you can actually pick it up before baby is born, kind of get familiar with the parts and things like that. There can be a little bit of a learning curve to even pumping. I often tell families too that pumping, like I said, is like a good way to help get milk removed, feed it back to the baby when you're not with the baby. But a lot of times it might not be as effective as the baby if the baby is a good nursing baby. Mm-hmm. Some people have to exclusively pump too if for whatever reason their baby can't latch or baby's ill or something like that. Then moms will exclusively pump to give their babies breast milk. And that's another way to feed your baby, which is totally fine. But yeah, then you become a little bit more familiar with the breast pump.
Mm-hmm. Great. So now we're going to talk a little bit about supply. On the first end of it, what tips do you have to manage oversupply?
So yes, we oftentimes will talk about oversupply and undersupply. Some people get worried about both. A lot of people sometimes would want oversupply over having an undersupply. However, oversupply can be a little bit detrimental too, or a little bit hard to deal with. So if you have, again, supply and demand, if you're having an oversupply, sometimes we'll say do like block feeding or block pumping and space things out a little bit so that you're not removing as much milk or not removing milk as frequently so that the supply can go down a little bit. Again, lactation consultants can be super helpful in this, but yeah, that block feeding is typically what we recommend to try to decrease the supply just a little bit so that we're not feeling like we always have to feed the baby or always feeling engorged or always having to pump to remove milk just to feel comfortable.
Right. Mm-hmm. And on the flip side, what about undersupply? What tips do we have for that?
Yes. So hydration, I think, again, super duper important. Some people swear by coconut water, electrolytes, Gatorade, that sort of thing. And then again, just increasing that milk removal, the amount of time that you're spending either nursing or pumping and how frequently you're doing it can really help increase supply. There are other supplements and things like that. Don't know if how much of that is really scientifically or evidence-based, but hydration and increasing the amount of removal and how often you're doing that.
Mm-hmm. And hydration is big throughout pregnancy, right? I have friends who say when they're breastfeeding, they're always thirsty.
Yes. Always got to have, your bottle of water nearby your recliner.
Yes. The toolkit for feeding. We're
Yep.
giving you as well. Awesome. Okay, so what should we do if we feel like breastfeeding is painful, whether that's having a dry or cracked nipple, or maybe later down the road when baby's teeth start coming in and it hurts? How can we alleviate any pain around breastfeeding?
Yes. So, yeah, at certain points, breastfeeding can be painful. I will start with the very beginning, like in the hospital when you're trying to get baby to latch.
Mhm.
Breastfeeding can be painful. Again, we've talked about this is supposed to be this natural thing, but sometimes it doesn't really feel natural or doesn't feel like you shouldn't. I mean, you have pain and you feel like you shouldn't. And so is that because the baby's latch is maybe not deep enough, or we're not getting the right amount of breast tissue in the baby's mouth to help express the breast milk? So that can be one of the biggest reasons early on that women experience pain with breastfeeding. And again, just trying to make sure we get a really good latch can be helpful there. And then as we are going forward, if all this, you weren't having painful breastfeeding and then all of a sudden it becomes painful. Sometimes that, like you mentioned, dry, cracked nipples, that can be a sign of like a yeast infection. Babies can get thrush in their mouth, and that's a yeast infection, and that can transfer to the nipple or vice versa. And so treating that, getting in to see your pediatrician can be helpful, and they can give the mom tips and tricks on how to treat themselves too, so that everybody's treated, so that we're not recontaminating or restarting that cycle there. Tongue tie is another thing that sometimes can cause like painful latch or difficult latch. I feel like there's lots of literature, lots of social media stuff out there about tongue tie at this point. I will say most of the time when I'm seeing patients, breastfeeding moms, tongue tie is not the issue for poor breastfeeding, or it doesn't cause issues long term. I usually say if the baby is latching well and it's not painful, then it probably isn't the tongue tie and you don't need to do anything about it. That always comes up. And then down the road, you talked a little bit about teething, or babies getting teeth. Typically, right when babies get teeth, they might bite a little bit, super painful. Both of my kids went through a little biting phase with nursing, but it's pretty short-lived. They kind of learn, that hurts mommy. So even now, my daughter is almost 17 months old. She's still nursing, and I mean, rarely is there a bite unless she's like super distracted and it happens by accident. So I think they kind of learn that they get over that phase really quickly, which is nice because that really hurts.
Yeah, no kidding. Good. Thank you for explaining everything in such detail. It's very helpful. I see a lot of comments coming through. Thanks, everyone. So many comments of, I'm expecting this day, this day. We are so thrilled for you and elated to have you with us on this journey. I also see a lot of questions coming through. Just a reminder, we are doing a Q&A at the end. So keep them coming and we'll get to it. Wonderful. Okay, so we've talked a lot about breastfeeding, kind of moving into more on formula feeding. How do we introduce formula? Maybe we started breastfeeding, but for whatever reason, it might not be working, or maybe we just want to start with formula from the get-go. How do we do that?
Yep, great question. So lots of moms will either transition to formula or start with formula from the get-go, or do a combination of breastfeeding and formula. There are tons of formulas out there, and it can be really tricky to know which one do I start with, which one is the best for my baby. There are some that are geared to try to emulate breast milk as much as they can. And so all of them, really, that is the goal, to try to be as similar to breast milk. But then there are some minor differences and different types of formulas that some babies may need for certain reasons. So first of all, like introducing formula, again, there's no right or wrong way to do it, really. If you feel like you're not making enough breast milk or you want to introduce formula, then you can go cold turkey. Some people mix formula with their breast milk to see if baby will take that better. So it really is just whatever you feel comfortable with. And then I usually just start with one of the mainstream formulas that are out there. And if for whatever reason there's an issue with that, then talking with your pediatrician about changing things. A lot of people are If a baby's really fussy, we'll start with one formula and then this is not working. We need to change things. But it can take a full 2 weeks to kind of reestablish how the gut is responding to something before we know that changes are really making a difference or not. So some people notice, with certain formulas, babies, if they were fussy on one formula and then they change, it might get better right away, but sometimes it can take a full 2 weeks or even a little bit longer. So I say, try to be patient, hang in there, talk with your pediatrician about which options are best.
Perfect. What tips do you have for helping a baby with reflux?
Yes. So we get this question a lot too. I always start out by saying, so reflux is just the stomach contents coming up or out of the mouth. Sometimes they will kind of settle in the throat. Baby will swallow it back down. I know that sounds a little bit disgusting, but very normal. So physiologic reflux is kind of that normal reflux that all babies will have a little bit of. I feel like every baby spits up every once in a while. And that is normal and common. I usually tell families if your baby is happy and gaining weight and like poops are okay or normal looking, then I don't get too worried about reflux. I don't know if my families love this or hate this, but I often tell them this is more of a laundry issue than anything else. So you'll be washing lots of burp cloths and clothing. But reflux can become an issue if baby's not gaining weight well, super fussy all the time. Their poops start getting involved too, like mucus in the poops or blood in the poops. Then we get a little bit more worried about the reflux causing issues. The baby, screaming, arching their back are some signs of that reflux that can be a little bit more pathologic or not physiologic, meaning maybe we need to do something about this. So what I tell families is baby stomachs are really small. There's a valve between the esophagus, which is the tube that goes from the stomach or from the mouth to the stomach. And that valve in babies is very floppy and loose. Anytime there's pressure on the stomach or the stomach is full, whether it's breast milk formula or a baby's doing tummy time, all that pressure can make stuff come up or come out. As babies get older, they sit upright more. Gravity can help keep things in the stomach. That valve gets a little bit tighter. So reflux often gets better close to like 6 months or so. But again, if we're having the babies that are super fussy, agitated all the time, not gaining weight, well, we think that reflux is playing a role, then we may treat with certain medicines. If babies are formula fed, we may adjust the formula and things like that. I hope that answers the question. But I feel like I could talk days and days on reflux.
Yeah. I'll have to link a video for everyone in the comments. The fall newborn expo we had an interview all about when baby has tummy troubles. So if that's something that you want more information about specifically, I'll make sure to link that video after this live. Perfect. Okay, so the next one says, what should I do if I feel like breastfeeding is taking a mental toll on me and I'm wanting to stop and switch to formula?
Yeah, so that's a great question. Again, breastfeeding is a topic near and dear to my heart, but it can be a struggle for some moms. And whether they want to admit it or not, it can be hard to kind of have that discussion. And what I tell families is, we're here to support you in any way that you want to feed your baby. And there's no right, whatever is best that you feel is for your baby, whether it's breastfeeding, a combination of breast milk, formula, strictly pumping, or just formula, all of that is totally fine with us. So if you need to or want to switch to just formula, or it's taking a mental toll on you, just know that that's okay and you are doing what is best for your baby. I do find that for some moms, like stopping breastfeeding cold turkey can be a little bit tricky just because, like we talked about, the supply and demand. So if you had a good milk supply, you may have to sort of wean down on your pumping or your breastfeeding just to decrease your supply. There are some ways to sort of quicken that process, but it can be painful if you were to stop cold turkey and have engorged, inflamed breasts and that sort of thing. So we want to help you through that as well. And we can kind of guide you on that if you ever have questions. But also, if your goal is to breastfeed, but you're struggling a little bit with it, or you feel like a lot of times I feel like moms have an issue keeping their supply, and then that is taking a mental toll on them because they really want to breastfeed or they really want to have enough breast milk for their baby. So talking with your lactation consultant, talking with your pediatrician, talking with your OB about how to increase your supply, or are there certain things that you're doing that are decreasing the supply, how to help with that.
Mm-hmm. We always say during these newborn expos, a fed baby is a happy baby. So when we are working on that and going through and troubleshooting these kind of issues, it is always, always, always encouraged to ask for help, just as Dr. Empson mentioned. So that's why we do these live videos every 6 months. So happy to help. Okay, we just have a few more questions on our list, and then we will hop into the discussion questions. So if you haven't left one yet, go ahead and comment it now so we can get to it in time. If you're watching this video later on, maybe tonight or within the next couple days, you can still leave comments and questions, and I can send them to Dr. Empson for you. Okay, so this one is a little bit down the line also, but how do we manage breastfeeding when introducing foods to baby? Do I breastfeed before they eat, after, an hour before? Can you talk a little bit about the timing of that?
Yeah, so again, I feel like there's no really right or wrong answer here. In the early stages, when we're introducing solid foods or pureed baby foods, which is around the 6-month age, breastfeeding or bottle feeding is pretty well established at that point. Oftentimes babies are a little bit more on a schedule, or a little bit more of a routine, I should say. And so introducing solids at that age, like between 6 and 9 months, they're really figuring out how to eat the solids. They're not eating for nutrition. That is still coming from the formula or the breast milk. And so I usually just say, like, do a feeding, and then maybe an hour or two later is when you can kind of trial some of those table foods or pureed baby foods to try to introduce. You don't have to like feed first and then do table foods or something right after. And I always say, like, it's low pressure, try to make it fun. My kids, when they first started solids, were not really into it. And I was just waiting patiently for them to take a bite, and they were not into it. So yeah, low pressure, make it fun, try not to like force them to eat things, and they will learn it in their own time. But again, the other thing I think that's important to remember is most babies will still consistently take like the same amount of breast milk or formula for the first between like 6 and 12 months. They're kind of consistent with the volumes that they're taking. Mm-hmm. And so adding in the pureed baby foods or table foods are kind of supplementary, just giving a little extra calories. And again, teaching them how to eat solids, but not necessarily taking over nutrition.
Mm-hmm. And speaking of nutrition, my last question here before we hop into the Q&A, can you talk a little bit about nutrition for mom? And, do we up calories while we're breastfeeding? Are there any more recommended foods we should eat? What would you say?
Yeah, so like I mentioned before, hydration, super important. Electrolytes in the hydration can be important too, especially if you're exercising or if you got ill or something like that, kind of replacing that, super duper important. And then if you're breastfeeding, you'll probably feel hungry all the time. And I say give into your indulgences, and just, eat for kind of satisfying your hunger. I think it's nice to have good healthy snacks available, but like high protein, high fat snacks. If you like eggs, cottage cheese, dairy, those sorts of things, protein bars. Like I talked about this recliner multiple times, having your hydration and some snacks on board or nearby can be super helpful.
Definitely. Get one with the pockets on the sides.
Yes. And then if you get sick while breastfeeding too, that can take a little dip on your supply. And so rehydrating after that, and trying to continue to feed through that. Otherwise, your supply may dip down, and it can take a little bit of time to recover that as well.
Mm-hmm. All right, perfect. Well, let's go ahead and hop right into this Q&A. We got some great questions. So thanks everyone for tuning in, and we really appreciate you watching live. Okay, so the first question is, I am due with my second in May. Congratulations. My first is 7. Can one baby breastfeed and another not be able to breastfeed? Does it change between babies?
Yes. So congratulations. Yes. So if your first was able to feed and you have struggle with the second, that can be a common thing, or vice versa. Some moms will find, oh, I had a really hard time with my first, but I really want to try to breastfeed the second one. And yeah, I feel like a lot of times, second time around, it can be a little bit easier because one, your body has made milk before in the past. Whether you were able to breastfeed for a long time or a little bit, your body has made some milk in the past. And I feel like it kind of snaps back. It might be like 2 years in between kids or something like that. It might come a little bit more quickly to sort of come back. But yeah, I think if your body has done this before, then second time around, oftentimes I find like for families and whatnot, it's a little bit easier, even if your first one had a hard time.
Yeah, perfect. I forgot to mention too, we will go through all the discussion questions and then we'll spin the wheel to draw for the live giveaway. I know you guys are antsy for it. We had a few questions about pumps, if you had one that you would recommend.
Well, I mean, I do. I mean, I have the pumps that I use, but again, those are the pumps that I use, and not every pump is one size fits all. So getting size for your pumps and the parts that come with it can be super helpful. I used a pump called the Spectra, and it was a blue one. You plug it into the wall to charge it up, but then you can take it with you wherever, which is nice, but it's a little bit bigger. It had really good like suction though. It was a good all around pump. My second time around, I got a little pump. It's called a Baby Buddha, and it's like the size of a cell phone, but a little bit thicker. And that worked very well for me as well. And that one was much more portable because it was so small. And it had a lanyard. I could wear it around my neck even. So pumping, doing the dishes, taking care of my older toddler at the time, which was really nifty. There are wearable breast pumps, so those you can slip into your bra and be a little bit more concealed. From what I've heard, those are great options. Like if you're super busy on the go, needing to pump while you're doing lots of other things, multitasking, as we often do as mothers. However, I have found that they just are not as effective as some of the larger pumps. So just being mindful of that. It's almost like a backup pump, or like use it when you absolutely need it, but it might not be your primary. So and I know there's lots more options of those ones coming out too. So just looking into, different options and finding what's best for you and what works for your lifestyle.
Yeah, perfect. We talked a little bit just now about nutrition. Someone wanted to know if you would give a specific number on calories consuming, or would you just say follow your hunger cues like we discussed?
Yeah, I don't have a specific calories. What I would say is that I was very hungry during my pregnancies, and I was very hungry during breastfeeding. And I just, again, would follow those hunger cues. And I feel like it didn't change much. Maybe I was more thirsty breastfeeding, but I feel like my hunger was probably the same as being pregnant. I hope that answers the question. But yeah, I don't think there's like a right answer, but we definitely don't want to be like calorie deficit, especially if we do start getting back into like an exercise routine or something like that. You kind of have to make up the hydration and the calories for that.
For sure.
I will add on to that too. I'm going to add on, Gabby. It's just be graceful to yourself, because a lot of people will think like, I need to get back into shape, but I'm breastfeeding, and some moms find it a little bit harder to get back into shape after breastfeeding or during breastfeeding. And give yourself some grace, and remember that you just built a baby in your body for 9 months, so it's not going to snap back in 4 weeks. So I hope that helps people too, is it will take time, and that's totally fine.
Yes. Amen to that.
So have your chocolate.
Yes. It's got antioxidants.
I know.
Okay. So the next question says, how long should a baby be on formula before switching? Did you say about two weeks to kind of get?
Oh, yes. So if you're trialing out formulas, I usually say we want to give it a good 2 weeks before we're making major changes. Obviously, if there was like concern for allergic reaction or certain circumstances like that, then we may suggest quicker. But usually we want to give it like a good 2 weeks, which can be hard if you have like a fussy baby or something like that. So reach out to your pediatrician. We have tips and tricks on different formulas that we may recommend for certain things.
Perfect. Do you have any recommendations on bottles that are like the breast?
I feel like there are so many options out there now for bottles, breast pumps, like we talked about. And I mean, what I recommend to new moms, if you are giving your baby a bottle and wanting to nurse, so they're supplementing with pumped breast milk during the day or formula, I don't think it's so much like the bottle or the nipple that matters, but it's the flow. So the flow of the breast or what's coming out of the bottle, I think is what's important. We want to try to simulate the baby trying to extract the milk out of the bottle like they would from the breast. Babies have a little bit easier time taking milk out of a bottle. A lot of times we're holding the baby up and using the bottle, and gravity is helping get some of the milk out. Or if it's a wider nipple, then the milk may just come out a little bit easier. So we try to simulate bottle feeding like we would a baby feeding from a breast. So again, there's different ways to do that, but a slow flow nipple can kind of be key there if your baby will tolerate that.
Yeah, perfect. What is the best way to track the amount of milk in ounces that your baby is getting when breastfeeding by latching?
Yes, great question. So I feel like that is one of the number one concerns that we get as pediatricians. My moms come in and say, I don't know if I'm making enough breast milk. How do I know how many ounces they're getting or whatnot? So we don't really care how many ounces they're getting as long as they're gaining weight and having good pees and poops. Those are good indicators. Just remember, people were breastfeeding long before scales were built and things like that. So try to remember that. If your baby's gaining weight, if they're growing healthy and having normal pees and poops, that is a really good indicator. But I would say most of the time by, I don't know, 2 months of age, they're probably taking 2 to 4 ounces per feeding. But again, breastfed babies will feed a little bit differently than bottle-fed babies. Breastfed babies may take an ounce at a time, and then an hour later want to take 3 ounces, and then 3 hours later want to take 3 ounces again. Whereas bottle-fed babies may be a little bit more on a schedule. So they don't have to eat the same amount every time either. I hope that helps.
Do you have any recommendations for scheduling both nursing and pumping? I have heard stories of strictly breastfed babies having trouble taking breast milk from pumped bottles when mom has to go back to work.
Yeah, so it's just kind of a new learning curve for mom and baby to try to get the right amount of milk, especially when mom goes back to work. So typically, and ideally, we'd like moms to pump about every 3 to 4 hours that they're away from their baby. So if your baby fed at 6 a.m., then you might want to pump at 9. And that's when your baby would ideally feed when you're away from them too. And then maybe another 3 to 4 hours after that. Again, every baby's a little bit different. And again, it's all supply and demand. So ideally, when you're pumping or whatever you're pumping, that's how much your baby is kind of taking at that time. About an ounce per hour is what breastfed babies take when they're away from their mothers. So that can kind of be your goal. If you have an 8-hour workday, maybe you're gone for 9 hours or something like that. And then the goal would be to pump about 9 ounces.
Yeah, perfect. We got a question on colic. I just want to let you know we are talking about that on Friday. So make sure you tune in and you'll get all the info then. So hate to leave you on a cliffhanger, but
there you go.
We'll talk about it. So
stay tuned.
Yes. If my plan is to strictly pump, how do you go about feeding a baby until your supply comes in? Is it best to start with breastfeeding to encourage supply, or start with formula and then switch to breast milk, or both?
Great question. So again, in those early stages, If you can latch your baby and they can get that colostrum, that stuff is so nutritious, full of antibodies, so great for babies. So if you can do that, then I would recommend that. And then you can start pumping once the milk comes in. Can be tricky, a little bit difficult to pump out colostrum because it's very thick and sticky. It can be done, but sometimes like hand expressing can be more helpful than a pump. So you can do that. Some people will supplement with formula until their milk comes in, but I would suggest that you still pump to try to get your milk supply in, because if you're just waiting for it to come in, but there's no actual stimulation to the breast, whether it's a pump or a baby, then it may not come in as robustly as we would like. Mm-hmm. So you could supplement with formula, but also you can try to use the pump to kind of stimulate breast milk supply.
Mm-hmm. If you don't start breastfeeding right away after birth, can you still start breastfeeding a couple months after?
Yeah. So again, supply and demand, it might be tricky. If you were breastfeeding like here and there, then it might be a little bit easier to sort of reestablish a full milk supply. But if you go a couple months without nursing at all, or removing milk, whether it's a pump or a baby doing that, then it might be difficult to kind of get a full supply. There are ways to induce breast milk production. Some patients who were not the birthing mother may choose to breastfeed their baby, whether like adoptive mother or something like that, and you can induce milk supply. So there are ways to do that as well if that is the goal. So I would say it can be done, yes. It just might take a little bit more work.
Mm-hmm. Yep. Okay, so we are going to do, let's see, 1, 2, 3 more questions, and then we'll draw for the wheel. So thanks, everyone. These questions are awesome.
This is great.
Yeah. Okay, so what are your thoughts on the Haka or some other device to catch milk while nursing on the opposite side?
Love the Haka. I used it with both of my babies for the first several months. But then I did develop a little bit of an oversupply with my second using the Haka. So I would say use it gingerly. If you don't know what the Haka is, it is a silicone suction cup that is like you can suction it to your non-nursing side while you're nursing and catch some of that letdown. I used it because my daughter would only feed on one side at a time. And so I collected a lot of breast milk, and then I didn't have to worry as much as having milk ready to go when I went back to work. But it can be very helpful, but you just have to be careful to not get too much of an oversupply. There are other types of collection cups now. Lots of companies make them too, that I'm sure are just as good as the Haka. Some are more passive, where you just catch the extra milk and save it. And I would say it used to be like, oh, put a nursing pad in your bra so that if you're leaking, you aren't getting your bra wet. And now it's like, well, we should actually be saving that milk because we can use it later for a baby or give it back to them. So just saving every drop, because as we all know, or maybe don't know, but everyone calls breast milk liquid gold. So we want to save every drop if we can. But yes, there are like passive milk collection cups where you just put it in your bra and collect the letdown from the other side when you're nursing, or there's the more active ones that you kind of suction it out as you're nursing. Either of those I think are great. If you don't have a major oversupply or want to help with your supply a little bit, they can be helpful.
Mm-hmm. Perfect.
Long-winded answer. I apologize.
Well,
I'm passionate about those.
Yeah, and you're so fresh on it too with your own kids. So
yes.
Expertise is from a pediatrician and a mom that's going through it, which is fantastic. So thank you for sharing. Okay, 2 more questions, guys, and then we will spin the wheel for the prize. So this one says, I've heard that pumps that don't plug in aren't as effective and can reduce supply. Is that true?
So that was kind of what we talked about. I think the wearable pumps may not be as strong of suction, and it just sort of depends on battery power. Again, there's lots of different brands out there, so it may depend on brand. There are hospital grade pumps that are super good suction, but like I mentioned, my pump that I used with my second pregnancy, I think the suction power went up to like level 12. And honestly, I don't think I ever went above a 3 because it would have been too painful, too powerful. Yeah. So every pump is a little bit different. Find the one that works right for you. Talk with people and go from there. But yeah, I do think that now they're making lots and lots more types of pumps. There's not just like this one or this one. There's multiple options, and yeah.
Perfect. The last question we'll do live is, my baby is not liking bottles. What should I do?
That is a great question. So we, as pediatricians, will try to tease out kind of why is that. A lot of times we'll recommend like trialing different bottles. Are they just starting daycare or something like that, where they're kind of going on a little bit of a feeding strike can be part of it. I think my daughter did that when she started daycare. We tried multiple bottles, and then I ended up going back to the ones I originally started with because she all of a sudden started taking them. So hopefully eventually they will start to feed. But yeah, if they're not taking and you're like worried about their hydration status or something like that, then definitely let us know. Otherwise, you can like syringe feed and cup feed in the meantime until they start taking a bottle, trying the different nipples and bottles. Again, there's so many options out there. Someone else feeding your baby. If you're trying to feed your baby, a lot of times we'll say they want it straight from the source. They want it straight from the breast rather than taking a bottle from you. So that could be part of it too. But yeah, there's lots of reasons why, and I'm sorry that you're struggling with that, but let us know. We can help you.
We can help you. And for all of you expecting parents watching, we do offer free meet and greets with our pediatrician. So I have it linked right above this video if you want to meet Dr. Empson and consider her as a pediatrician, or any of the other wonderful, wonderful peds that we have that we will be interviewing this week. I'll make sure to link it on every video, and you just submit your info quick and we will reach out to you and get a meet and greet scheduled. And Dr. Empson, a question we get a lot is, when should I be scheduling or booking a pediatrician? Is it too early if I'm pregnant? Should I wait till the baby's here? Should I do it in advance? What would you say?
Oh, great question. We don't mind at all if you want to come and meet us before baby is here. We love that. Get to know you a little bit on a personal level. We are totally fine with that. And then once you're in the hospital, they will ask you who your baby's pediatrician is going to be, and the rest is taken care of, which is so nice. You don't have to like let us know ahead of time, but you can do a meet and greet. And then once you get to the hospital to deliver your baby, you let them know who you chose and they get a hold of us.
Yes, wonderful. Okay, so you guys have been waiting and waiting, and we're going to go ahead and spin the wheel. And don't worry, we're doing these giveaways every live this week. So if you don't win today, there's always another chance. But okay, Courtney. Oh, the glare. There we go. Courtney G, you are our winner. So congratulations. We will shoot you a message after this to get your info to claim your prize. But thank you so much, everyone, for tuning in. This was such a wonderful start to the Spring Expo. And we know there is so much that goes into feeding, both breastfeeding and bottle feeding. So if you have any follow-up questions, reach out, and we are more than happy to help you on your road to parenthood. So thank you, Dr. Empson.
You're welcome. Thanks, everybody.
All right. Tomorrow we will be live with Dr. Annie Zimmer on newborns and routines. And you might be thinking to yourself, how the heck am I going to have a newborn and a routine at the same time? We're going to talk about it. So make sure you tune in tomorrow at noon, and we will see you then. Thanks, everyone.